Welcome to Lessons in Leadership. I'm Steve Adubato with my colleague, co-host, executive producer, Mary Gamba. How's everything, Mary?
I'm doing really well, Steve, today. How are you doing?
I'm doing great. We're going to be talking corporate philanthropy, support of not-for-profits, and what that has to do with leadership with our good friend, Maria Spina. She's a program manager with PSEG Foundation. But Mary, before we do that, speaking of corporate philanthropy, can we let everyone know who supports and sponsors the great Lessons in Leadership?
Of course, we can. We have some wonderful friends that support our efforts and make this possible. We've got Prager Metis, Valley Bank.
Which is a great accounting firm, not just because we have a leadership academy there. I'm just saying.
Not just because of that. No, they're the best. I feel like they're family at this point. I love it. NJ Sharing Network, who are literally saving lives in every day. I always tell everyone,
go out. Donation.
Yep. If you are not an organ and tissue donor, please go out and register and make that happen.
By the way, can we do this in post-production? Sylvester, can we make sure we put up, as we talk about the sharing network, let's start putting it up, because there are 5,000 people waiting in New Jersey for an organ and tissue donation. I'm not going to turn it into a commercial, but it is. Go on that website and find out more. Go ahead, Mary.
Definitely.
I'm sorry.
Yep, we'll get that website on that screen. Thank you, Sylvester. The International Union of Operating Engineers, Local 825. And then we have Seton Hall University and the Seton Hall University Bassino Leadership Institute. And while I have the floor, I would also like to let people know where they can find you, Steve, on Twitter. And that is at Steve Adubato, Adubato. You'll see it up there on screen, as well as on Facebook. It's Steve Adubato, PhD. And finally, if you're watching us on News 12 and you want to check out our other broadcasts of Lessons in Leadership, or just get some really great valuable tips, tools, articles for free, you can go to our website at stand-deliver.com.
Well said. By the way, speaking of corporate philanthropy, let's put up Maria Spina, our good friend from PSEG Foundation. PSEG, let me tell you something. Huge supporters of public broadcasting. If you watch our colleagues on NJ Spotlight News every night, you'll see they are right there. They support what we're doing on our not-for-profit end at the Caucus Educational Corporation. Maria, welcome to Lessons in Leadership, my friend.
Thank you, Steve. Thank you, Mary. Thank you so much for having me on your show.
You got it. Mary and I have been talking about this segment as we led up to it. And this is the thing that we want to get out there, and Mary will pick it up after my question. Not-for-profit leadership, is it any different than corporate leadership? Why do we call it not-for-profit leadership, Maria?
No, it isn't. I think, it's really important in any level of leadership to be empathetic and genuine. You have to really understand people. You have to be able to empower people. And these are attributes, especially in corporate philanthropy, that are important to really connect with the community. We all have different paths, but to be able to provide that assistance for the journey ahead is so important. And we find that to be very important at the PSEG Foundation.
Mary?
Yeah, and Maria, a lot has changed. I mean, we're taping this on February 18th, 2021. When this airs, it'll be past the 1 year anniversary of when COVID hit. How did PSEG Foundation, how did you have to pivot your focus and really who you were giving to, how you were giving? Talk a little bit about that, because so many organizations were just looking to help, whether it was first responders. So talk a little bit about what PSEG Foundation did and why it was so important to do so.
Yeah, thank you, Mary. It's hard to believe it's been a year already. We were all facing the reality of grappling with social distancing, potentially getting sick, and safety measures and precautions that we all had to take. In the very beginning, the PSEG Foundation was very responsive to our community needs, understanding at that time that while many of us were grappling with the reality of empty store shelves, there were folks who were really dealing with losing their jobs and not having food to put on the table. And that being said, it's a sad reality that has existed pre-COVID as well, only exacerbated by the pandemic. And so the first area of focus that we provided support to was food banks, really with those organizations that are helping communities cope with food insecurity. But following that, and just hearing many different organizations reaching out to us, our foundation announced a $2.5 million 2-year commitment in response to COVID, which included a signature grant to the New Jersey Pandemic Relief Fund, some mid-sized grants to regional nonprofits within our territory. And we also ran an RFP program for grassroots initiatives to help communities.
Maria, one second. RFP, request for proposal, correct?
That's correct.
I'm sorry, pick it up from there.
It's okay. We ran that program for grassroots initiatives to help organizations that were dealing with the reality of food insecurity, providing support for PPE and cleaning products, not only for their clients, but for their staff as well, and other types of wraparound services to help communities cope with the social and emotional aspects of the pandemic.
Sure thing. And as a nonprofit leader yourself, we always ask this question, and it's funny because before COVID, we asked the question, "Oh, what's the biggest leadership lesson that you've learned?" And you never knew what you would hear. But now, since COVID has happened, I feel, as they say, nothing will ever be the same, and nor will the answer to this question. But as a nonprofit leader, what is the biggest leadership lesson that you've learned, in this 1 year plus since COVID really hit us hard?
I think it still stands the same, and the reality is that you need to be empathetic. Communities are hurting. They're hurting in many different ways. They're hurting by what they've experienced and the fear of all of this, and the social impact that we try to provide is tremendous. But it's something that I think is going to stay for a while.
Maria mentioned the New Jersey Pandemic Relief Fund. Mary, again, in post-production, you can tell that we're doing this live and we just talk to each other as if it's just us. We'll put up the Pandemic Relief Fund site. And also, please look at our not-for-profit website at steveadubato.org, because we did an extensive interview with First Lady Tammy Murphy, who heads up the New Jersey Pandemic Relief Fund, and PSEG, the foundation, was right there early on, and others came on board as well. So Maria, I'm just going to ask you this. I appreciate you sharing not only what the foundation is doing, but also the leadership lesson you've learned. I'm going to ask you this. For not-for-profits, like our Caucus Educational Corporation, others trying to stay afloat, right? Mm-hmm. Fortunate enough to have corporate support, foundation support. But leadership development in the not-for-profit world, there are some who believe we don't have the money. We don't have the time to develop our people. Plus, we're not a corporation. We're not here trying to make money. And my view is, well, wait a minute. You have to run lean, efficiently, think strategically, be innovative. What's the difference? No, you're not making a profit, but if you go out of business because no money, no mission. I'm on my soapbox again, Mary, sorry. Maria, here's the question. The importance of leadership development for nonprofits.
Very important. And in fact, not only, again, pre-COVID, some of the areas we've supported is around capacity building. Very important for organizations to be able to thrive in this critical time. They are really the voice in the community. So I think that's very critical service that we can all help support.
Yeah, you don't have that luxury to say, man, it's not really a good time to develop leaders. Really? Okay, sure. There's no convenient time. Maria Spina, who is the program manager at PSEG Foundation, they make a difference. That's all I'm going to say. Corporate leadership isn't just about having a bottom line that makes sense, black and red, mostly black, if you will. It's about giving back and making a difference. And then that's what Maria and her colleagues do every day. To Rick Thigpen and everyone down there that we work with every day, thank you for what you do, Maria. We appreciate it.
Thank you. Thank you so much for having me on the show.
You got it. We'll be right back right after this. This edition of Lessons in Leadership with me, Steve Adubato, and my colleague Mary Gamba is brought to you by Valley Bank, the Buccino Leadership Institute at Seton Hall University, New Jersey Sharing Network, Prager Metis, the International Union of Operating Engineers, Local 825, and Seton Hall University, showing the world what great minds can do since 1856.
This is Mary Gamba. If you want more leadership tips and tools, log on to stand-deliver.com. That's stand-deliver.com.
Welcome back to Lessons in Leadership. Steve Adubato, Mary Gamba. By the way, Mary, let everyone know where they can find us other than News 12 Plus.
Sure thing. We are now in so many places. You can find us on NJ.com. You can find us on Spotify, Apple Podcasts, Google Podcasts, as well as on our website. That'll direct you to all of those places at stand-deliver.com. We've got a lot of great free articles up there. You can just find our past videos. So there's a lot of cool things. And while I've got you, I'd love to thank our promotional partners as well. CIANJ and Commerce Magazine, and NJBIA and New Jersey Business Magazine as well. And lastly, if I can, because I love plugging so much, I'd love to thank our funders one more time. I know they're rotating on screen, but we cannot thank them enough and give them enough high fives. So we've got Prager Metis, Valley Bank, NJ Sharing Network, International Union of Operating Engineers, Local 825, and Seton Hall University and the Buccino Leadership Institute.
Love it. By the way, you see this? No detail too small. I'm looking behind me. Scarlett, don't go crazy. I know I'm doing this.
Now
There's my wife, Jen. I'm going to move that a little bit. I don't want to cover the Emmy. I'm moving that there. Because that's Olivia, our daughter. She wanted to know why she wasn't on camera.
Oh, you should bring her into one of our shows. Maybe we'll bring her in later when we have my dad on. We'll do a family show.
Yeah, because she's in remote learning. I'm sorry.
Why did you have to put that in air quotes, Steve?
No, she's learning. She's learning.
Well, they're learning something. I'm just not sure what it is. They're definitely learning how to be resilient and pivot and be creative.
Yes.
And lifelong learners, because they definitely have to do a lot more on their own, but it's working out really as good as it can. So high five to our educators as well.
We agree. By the way, did I just block my book? Because if I did that, I love my daughter and my wife.
Yeah,
but
we
that
can
would...
see you. We can see you.
So, stop fooling around. I'm sorry. So Maria Spina, the PSEG Foundation, thank you so much. We're about to go into an interview with Barry Ostrowski, the president and CEO of RWJBarnabas Health. But there are a couple of things that Mary and I want to talk about. And Mary and I keep saying, let's leave more time for us to talk because we've got a million things that we're doing related to a book that Mary and I are co-authoring. See if I got the title right. Lessons in Leadership.
We changed it so much. So go ahead. Let's see.
It's a follow-up to Lessons in Leadership, but Lessons in Leadership, Innovation and Disruption in the Age of COVID and Beyond.
I think that's great. We should ask people to write in for their thoughts on that title, but I think it's a great title because it's not just about innovating. Obviously, COVID made us all innovate, right? It made us all decide, all right, how are we going to pivot? What are we going to do? We were forced to innovate because if you don't innovate, you die. We've talked about that a million times. But now it's going to be past that. It's going to be, all right, now we're all into, unfortunately, the rhythm of COVID and working remotely. But how are we going to continue to innovate? Because we could just as easily get stuck in a rut now. So that's why we do the COVID and beyond.
So here's an interesting connection to that. So we've been interviewing, and a lot of the book will be based on interviews that we're doing in Lessons in Leadership, that we're conducting in Lessons in Leadership. And so I said to Mary, I really like the idea of each title being relatively short, pithy, big, bold print. I just stuck myself in the eye. I'm sorry. The magnifiers.
I love that we're on live TV. Yeah, it's great.
Trust me, they're not editing that out. So
no, we're leaving that in.
So here's why I'm saying it. Mary and I would say this all the time. We met 20 years ago I was at Barnabas at the time in the hospital. Yep. Mary was working there, not as a nurse. No. You were doing patient rep stuff. Yeah. And the book that I had was written on the end table was Richard Carlson, Don't Sweat the Small Stuff. Why is it relevant? Because I've been saying to Mary, I want this book to have chapters that are short and pithy. And the thing I loved about Carlson's book, Don't Sweat the Small Stuff, is he had these really great titles like Beware of the Spiral Thinking.
Mm-hmm. The busy mind syndrome was another one, like beware of the busy mind, because your mind is always racing, right? What's coming up next?
The Theory of Separate Reality. So I said, okay, so our chapters, I'm going to throw out some of our chapters. And one of them really has to do with confront the situation, be upfront. Confront the situation, be upfront. And Mary triggered this, and I'll let Mary talk about it. When you don't know, our good friend Neil Shapiro, the president of WNET, his quote is, when you don't know, say you don't know. Mary, Peloton, John Foley, the CEO, who we're pleased to interview, you've been waiting for your Peloton bike.
Mm-hmm. Yep, I've been waiting about 7 weeks, and I have
as
about
we do the show now. Go ahead.
Yeah, as we do the show right now. So in about 3 more weeks, it was a 10-week waiting period. But Steve, you've talked about it for so long. I said, all right, I got to try this because especially with the
we love Peloton.
And with the cold weather and getting outside and gyms being closed, I said, all right, I'm going to do it. But it was, they told you right up front, we know it's going to be 10 weeks and you have your date when it's going to come, but they could have just let that be that. They didn't. I got an email from the president, everyone I'm sure did, of Peloton, and he was simply saying, we know that you're frustrated. We know that it's a long lag time. We want you to understand why. And they actually went into the why, which I was like, oh my gosh, I didn't even think of the fact that they're shipping containers and there's delays and there's this and there's that. And I'm like, no, isn't there just somebody down the street like Amazon making my bike and they're going to drop it off? And he just opened my eyes, number one, to what a great company it is, because he didn't have to do that. I already knew I have my date, it's coming. But just to take that extra step and to say what you know, what you don't know, and to acknowledge and to empathize. And we've talked about that on the show so many times, the importance of empathy. And he really connected and resonated with me. And I'm like, what a great way to start this off because, oh, and the other thing, even though I don't have the bike, they allow you to use all the free apps and the exercises and the yoga. And again, not that this is an advertisement for Peloton, but it's an example of an organization that really gets it and understands what people want. And that's just to be heard and to feel like you understand what we're going through.
What does that have to do with leadership?
Everything, because leadership is all about empathizing. It's about communication. It's about sharing information, being upfront. If you don't know, say so. If they would have said, listen, you can order it, we don't know when it's going to come, I would order it anyway. Like, keep me posted. The worst thing is a company that doesn't give you updates. You don't know if it's coming. That would just leave a bad taste in your mouth.
And it's funny, people who you hear the word leadership and they think, oh, the president of the United States, the head of a university, the head of a hospital. Barry Ostrowski is going to be on in a minute from RWJ Barnabas Health, a corporate executive. Here's the thing. This thing about leadership, lessons in leadership, is for all of us who are in positions where we must lead, and that could be anywhere. So I said to Mary, remind me to share the plumber story.
I know, I didn't even get my opportunity to, but can you please share the plumbing story?
So listen, we love our plumber. Not going to mention the name. They're great. But we're about to sell the home that we're in and move into a new home. There'll be a new studio, it'll be a different look, et cetera. So I'm watching, I'll admit it, it was about 7 o'clock at night. So I'm watching one-on-one on public broadcasting. And I hear my wife, Jennifer, yell, what? And what just happened? I got scared. I thought something happened. And I look and I run into the kitchen and there's water all over the place. And she's holding the top to the faucet. I go, what? The faucet broke. And she put it back on. Water came out again. Called the plumber. Now, as we do this show, it's snowing. It'll be seen later. It won't be snowing. Why is this relevant? Next day, Jen, the faucet, no, and she has a big sign, don't touch. Jen, what about the plumber? Where's the I don't know. Give me the number. So I call. She runs the house. She's the leader. Trust me, there's a point to the story. I call the plumber. The plumber's person answers the phone, whoever it is. Oh, yeah, you have a problem with the sink? Yeah, yesterday. What's up? Oh, the snow. It's put us back. Put you back. Okay. Well, you're only telling me because I asked you. Mary, what would great leadership have been if they weren't going to get there on the day that the water was exploding all over the house? I know you can't get there, and I know I'm impatient. That's not the issue.
Yeah,
it's appropriate communication.
Proactive. If they proactively reached out and said, listen, we have concern for the safety and well-being of our team. We are going to wait until the roads are clear. We will give you an update in a few hours to let you know if they could make it today. If not, unfortunately, we do need to come tomorrow. That's it. And then it sets expectations.
Trying to call another plumber. Give me the option. Oh, yeah. What are you saying? We should come out in the snow? No, I'm saying you're only telling me because I asked you.
Exactly.
Leadership is about it being assertive, proactive communicator, even when something can't get done. Telling me it can't get done. When Mary with the Peloton bike with John Foley, that matters. It matters.
It does.
It gives you options. Go ahead, Mary.
And I was just going to say,
expectations.
I was just going to say, it helps you to manage expectations. There is nothing worse than not knowing. It causes a lot of unnecessary stress. There's stress that we can avoid right now with COVID. There's things that are outside of our control, but letting your key stakeholders, if it's your customer, whoever it is, it could be
your team, your boss,
your boss.
Mary, how many times we say, oh, that's the deadline. Geez, well, Steve, we agreed on a deadline. I'm not going to make it. Then I'm calling, where are we with? What do you mean?
Or and if you can't,
Elvin's saying we're over by a minute. I got it.
Why? See, I told you we need more time.
What happens when I'm saying to a team member, where are we with? And I'm sending these ridiculous emails over the weekend. Well, why weren't you telling me where we were with
All
that
we
if
need
we missed
to
the
do,
deadline?
and that's the thing. If you communicate with your boss, sorry, I know said I was going to get it to you by 5. I'm going to get it to you by end of day tomorrow. Is that okay?
I'm fine.
Mm-hmm.
It's fine.
Yeah.
Don't leave me guessing. Don't leave Mary guessing about her bike. Don't leave me guessing about never mind.
Is it fixed though? That's what I want to know. Don't leave us hanging.
You ready? Plumber comes this morning right before lessons in leadership. My wife says, listen, I know we're way over budget on the new house. We need a new, and she started to describe it. And I went, la, 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 la. I can't listen. And I walked away. Meaning the answer is not yet, but
it's on
the
its way.
checkbook is out. I'm sorry. Listen, Barry Ostrowski, important stuff. Barry is the president and CEO, RWJ Barnabas Health. A compelling, important conversation about leadership with Barry, and Mary and I will be back on the back end. I'm going to fix the sink. Be right back. Hi, I'm Steve Adubato coming to you remotely. Listen, I don't know how long it's going to be, but we'll keep doing compelling public policy-oriented program when we kick off today with Barry Ostrowski, President and CEO, RWJ Barnabas Health. Good to see you, Barry.
Same here, Steve. Thanks for having me.
There are a couple things I want to talk about. We'll get to this Modern Healthcare magazine recognition in just a minute, which is a big deal. But the co-authoring this book, Changing Missions, Changing Lives, how a change agent can turn one ship and create impact. What's it about and why does it matter so much? You are the co-author of it.
Look, Steve, I think it's about our journey here at RWJ Barnabas Health. About 4 years ago, we decided that great clinical health care is a terrific thing, but it's not enough to make our communities healthy. And so we invested in an entire platform of social impact programming, and that changed the mission of the organization. And so we have a very simplistic goal. Whatever we do needs to be adjudicated in the realm of have we made the community healthier? And the data is clear, the academic research is clear. Simply having clinical programs is insufficient. That's only a 30 to 35% impact. The rest of it, for the most part, are social issues. And so we wrote this book to basically say to others, if it's your intent to help people, or if your core business is something other than healthcare, but you feel and should feel an obligation to improve the communities you serve, here's an approach to do so. You can adopt a mission that links that which you do directly to the community, and you can build social programs that will have great impact on those who live in our communities. Frankly, we couldn't be happier having done that. It will take a long time for some of these programs to show the kinds of results we all aspire to see, but nonetheless, it's galvanized our employees, it's motivated all of us to do more to help our communities, and needless to say, we're talking to each other in the midst of the second surge of COVID, and our communities are suffering now more than ever. So we're delighted with the new mission, which is now 4.5 years old, but we encourage others to consider the same.
So, by the way, I disclose a couple of things. Micheline Davis, the co-author of that book, a board member of ours, RWJ Barnabas Health, a longtime supporter of public broadcasting, including what we're doing. Also, Barry, you are on the board of NJTV, are you not?
I am, yes.
Yes, you admit that.
I do.
And
I don't have my own show. I don't have my own show, but I'm on the board.
Well, we're working on it. So, but Barry, here's the other part of this. What I often think about is with healthcare organizations, yours and other large systems and other smaller systems under hospitals are struggling financially in the age of COVID, big time, right? How do you meet the bottom line needs of a massive healthcare organization like RWJ Barnabas Health, but still keep this commitment to an anti-racism initiative, fighting against the social determinants of health, having social impact? How do they balance out?
That is a great question, Steve, and it is the challenge. And it would be disingenuous for me to suggest that it's an easy thing to do. We're fortunate. We've had multiple years of outstanding margin growth. We've accumulated resources. And so the choice is, how do you allocate the resources you have acquired versus how much money you may be earning at that given time? And it's been our decision that we would use that which we've been able to accumulate over time and make sure that we allocate it to these social programs and, of course, our anti-racism journey that we began not long ago. Now, no one pays for that, and so we need to pay for it ourselves. And in our case, when we look at next year and we see there'll be hundreds and hundreds of millions of dollars of revenue that we will not collect, we made an overt decision that, unlike the usual industrial response by organizations like ours to reduce the workforce, we're laying no one off. And that is going to, in fact, reduce our ability to create any margin. It'll reduce our ability to take in maximum revenue, but still, it is our commitment that if we were to lay people off and reduce workforce just to balance the books, we'd be creating more hurt to our communities. So in our case, we're effectively using that which we have accumulated over time. Now, you can find efficiency, and you can, in fact, go by for a year or two living at more or less a break even or even a bit of a loss. But in my view, if you retrench from the mission, if you step back from improving the communities, you've lost it. And so you have to continue.
This is Mary Gamba. If you want more leadership tips and tools, log on to stand-deliver.com.
Promotional support for this edition of Lessons in Leadership with me, Steve Adubato, and my colleague, Mary Gamba, has been provided by NJ.com, NJBIA, and New Jersey Business Magazine, CIANJ, and Commerce Magazine. Lessons in Leadership. This is my wife, Jen. She's at our new house. Jen, where are you right now?
I'm in the library.
Look at this is our new house I was just talking about.
That sounds like a game of Clue. She's in the library with the metal pipe and Mr. Crow Mustard.
This is your room. This is the room you wanted.
Jen, conservative estimate, how many books do you think we have?
2,000, maybe more. What do you think?
Jen says, why don't you just read off the lap? No, I like books. That's our new house. By the way, Jen, I just told the plumber story. When the thing blew up and there's water all over the place, first, did you overreact?
No, I was surprised by it because it just started spraying water all over. What do you mean overreact?
Did I not jump in and fix the sink right away?
Oh my God, goodbye.
Okay.
I love this show. You never know what's going to happen. Now that's leadership.
I'm sorry.
Leadership,
By the way,
leadership is, hey, I got to say something. Leadership is about knowing what you can and cannot do. You obviously know you cannot do anything with a wrench or a hammer, so you called a friend. And that's leadership. It's being able to delegate and accept those things you cannot do.
These are very soft hands. Okay, I'm sorry. By the way, Barry Ostrowski was great.
He's great.
I apologize. This is a serious show about leadership. My wife, Jennifer, is the CEO. She's running the move to the new house. She's running the move out of this house. Mary, biggest takeaway, not from the new library, not from the plumber, but from Barry Ostrowski, biggest takeaway for you.
He really just talked about being efficient, especially obviously they're in a clinical setting, right? Like we're able to work from home, everything during COVID, we're able to keep it going. With him, I mean, you're running a major hospital system with over 35,000 employees. So it was really about just changing lives, being there for your team, while also managing your bottom line.
How about social justice?
And
How about
social justice.
It's social justice, commitment to fighting racism.
Yep.
Someone might ask,
They
what
didn't
does
give
that have
up
to do
on
with
any of that.
leadership?
And that was the thing. None of that stopped. They figured out, cut elsewhere, figure out, because you still have your mission and you need to make sure you follow through with that mission. And they did just that. That
was Barry Ostrowski. That's Mary. This is Steve. Thanks to our team behind the scenes. Thanks to my wife, Jennifer. By the way, she had no idea. She said, FaceTime me. She will not be happy about that. I'm going to find something to fix in the house. That was a joke. See you next time. Mary, say goodbye.
Goodbye, everyone. And thank you, Steve.
Yeah, I'm going to apologize to my wife. See you next time. This edition of Lessons in Leadership with me, Steve Adubato, and my colleague, Mary Gamba, is brought to you by Valley Bank, the Buccino Leadership Institute at Seton Hall University, New Jersey Sharing Network, Prager Metis, the International Union of Operating Engineers, Local 825, and Seton Hall University, showing the world what great minds can do since 1856.
This is Mary Gamba. If you want more leadership tips and tools, log on to stand-deliver.com.
Promotional support for this edition of Lessons in Leadership with me, Steve Adubato, and my colleague, Mary Gamba, has been provided by NJ.com, NJBIA, and New Jersey Business Magazine, CIANJ, and Commerce Magazine.